everyone, I'm Niharika, a student from RV Dental College. I'm here to give a small talk on the oral health hygiene for teenagers. In my talk, I'm trying to educate about the importance of maintaining a good oral hygiene as a teenager, the most common dental issues faced by teenagers, bad consequences of smoking, drugs, tobacco consumption, and some methods of prevention of oral disorders. You may wonder why oral health is that important as a teenager? Teen oral health is incredibly important. With calendars stacked with schools, sports, and social lives, it can be easy for teens to toss around oral hygiene to the wayside. It's important to prioritize it. Teens can develop a false sense of security about their oral health. And why shouldn't they? They've grown out their baby teeth, and with a brand new set of strong, healthy adult teeth, they think they can eat anything without any oral health consequences. Most serious oral health conditions experienced by older adults, such as gum disease, recessed tooth, and tooth loss, are degenerative oral conditions that start with the humble beginnings during adolescence. For example, consider tooth plaque. Plaque, that fuzzy white stuff that can build up on your teeth, might seem harmless enough. It can be scraped off with your fingernails. But if you allow plaque to remain on your teeth along the gum line for another 10 to 20 years, especially in hard to reach areas, it will slowly penetrate the gum line and move along your tooth roots into your gums. By then, you have a high risk of experiencing periodontal disease, a serious oral health condition that can lead to tooth loss and other health issues. It's a gradual process that can take decades. So, if you are a teenager, now is the best time to lay the foundation for an oral health care that will ensure you keep all your natural teeth for life. As a teenager, there are few very interesting and important points about your oral health hygiene that you should always be aware of. The first point and the most important thing is about tooth decay. Tooth decay or the tooth caries is the gradual restrictions of the tooth structure which is caused due to poor oral hygiene, consumption of high amount of carbohydrate and sugars. In the early stage of tooth decay, the outer layer of tooth, which is the enamel, can repair itself if the issue is caught and treated right away. Later on, with more advanced tooth decay, the lost enamel cannot be repaired, which may further affect the underlying layers, that is, the dentine and pulp, which may further lead to the infections of the pulp cavity. The next point is about the dental sealants. It is a quick, safe, easy procedure that can provide that extra level of protection on your teeth. It can be tough to reach all the surfaces of your teeth when brushing and flossing. Sealants can actually lower the risk of tooth decay by as much as 80% when applied to your molars. And the next point is about braces, aligners, and retainers. As your permanent teeth fill in during early adolescence, it can lead to some overcrowding or bite issues that can require an orthodontic fix. It can be beneficial to have a consultation with an orthodontist after most of your permanent teeth are in to determine if there are any corrects to be made. Teens are often self-conscious about their appearance and smile. Orthodontic treatment can improve self-esteem and overall quality of life. Orthodontics often include the use of braces which realign your teeth through braces and wires that apply pressure. Braces are readjusted every several weeks until the proper and desired bite is achieved. Next is about the safety measures that should be taken by your teen athletes. If playing a contact sport or a sport where there is a chance of being hit in the face or mouth, wearing a properly fitted mouth guard is recommended. The mouth guard can prevent trauma and damage to your teeth, lips, tongue, and your jawbone. You should all be aware of the common side effects of bad oral health habits. Poor oral hygiene, especially in the teenage years, can set you up for a lifetime of issues. If you do not take good care of your mouth and teeth, you can run the following risk. Example, tooth decay, cavities, gum disease, tooth loss, bad breath, dry mouth, tooth pain and sensitivity, oral cancer, infections and illness. It is important to refrain from smoking or using tobacco products. Also, steer clear of excessive alcohol consumption and recreational drugs. All of these products have negative inputs on mental and physical health and also on your oral health. Smoking, in particularly, can raise your risk for gum diseases, oral cancer, stained teeth, bad breath, and a dull sense of taste and smell. Another potential pitfall to avoid is damage from oral piercing. Piercing of lips, tongue, and cheek can damage your teeth and gums and cause sensitive or cracked. There are few very important measures that you can adapt in your life which helps you prevent any kind of dental issues. We all know brushing and flossing your teeth can help to keep your smile bright and white. It can also help to minimize and even eliminate bad breath. So, brush your teeth twice a day for 2 minutes with a soft bristle toothbrush. Hold your toothbrush at a 45-degree angle to your gums. Use a toothbrush that fits into your mouth and can reach all of your teeth. Replace your toothbrush every 3 to 4 months as it gets worn. Brush in back and forth strokes, being sure to get all surfaces of your teeth. Use an up and down motion to get behind your front teeth. Use a pea-sized amount of fluoride toothpaste. Remember to lightly brush your tongue too. Floss between teeth that touch each other every day. Limit snacking between meals. Eat a nutritious diet and minimize your consumption of sugary, sticky, and starchy foods. Try to avoid a lot of sugar, sports drinks, and sodas. Do not smoke or use tobacco products. Drink enough water to keep your mouth moisturized. Part of establishing a good oral hygiene routine is going to the dentist regularly. Your dentist can help you determine what is the best schedule for you. Most of the time, dentists recommend teens have a regular checkup and professional teeth cleaning every 6 to 12 months on average. So ultimately, it's important to stay on top of oral hygiene during the teen years. Doing so, you can save a lifetime of future troubles. So, keep smiling, stay healthy. Thank you everyone.